Welcome to The Big Squeeze, a Sioux Falls blood pressure initiative that began in 2011. My name is Carla Lubin, and I'm a faith community nurse at Sanford Health. I've been involved in the program since its inception. It began as a grassroots community awareness effort, and it has since grown to be an annual citywide screening that's coordinated by LiveWell Sioux Falls. Other partners are the local hospitals, clinics, pharmacies, dental offices, and many businesses. And that's just to name a few. Thousands of people in the Sioux Empire have been screened each year, and they've learned why it is so important to know their numbers. We're excited to have you join us to screen thousands more. The goal of the Big Squeeze is to increase awareness of high blood pressure in our community and reduce the incidence of cardiovascular or heart disease. Cardiovascular disease is the #1 killer in the United States, but we believe this can be changed. One way to do this is to help people identify and learn about heart disease risk factors that can be controlled. High blood pressure and large waist circumference are two of these risk factors. They are easily identified by a simple screening and can be modified with proper treatment. The rest of this training video will give you the protocol used to take an accurate blood pressure and measure a waist circumference with confidence. It is very important that all of your screeners use the method presented today. Please don't assume a care provider always takes an accurate blood pressure because of their title or past training. Research shows 30 million Americans will receive inappropriate antihypertensive treatment due to an inaccurate high measurement, and 21 million people will not be diagnosed because of an inaccurate low measurement. In fact, it's estimated that 35 to 60% of healthcare professionals in the United States measure blood pressures incorrectly. One goal of the Big Squeeze is to make sure all providers in our region measure blood pressures accurately each and every time. So let's get started. The auscultatory method of blood pressure screening with a calibrated instrument is preferred. That means using a manual cuff and listening through a stethoscope. It's still the gold standard. You should have your cuff calibrated about once a year, and it should not be used if the needle on the dial does not sit right at 0. It should return to 0 after each use. Using an electronic blood pressure monitor is acceptable if it has been tested alongside a manual cuff for accuracy. But remember, it will only be accurate for participants with a regular pulse. Wrist monitors are not ideal and must be used with strict regard to the manufacturer's special instructions. They should not be used for a diagnosis of high blood pressure, only for screening. Finger monitors are simply not accurate enough to be accepted as an accurate screening method. Now we will demonstrate an accurate blood pressure. First, we prepare our participant. Provide a place for the participant to sit for at least 5 minutes so they're calm and quiet. Assist them to fill out the demographic screening form provided. They should avoid caffeine, smoking, and exercise 30 minutes before the measurement and should have an empty bladder. Legs need to be uncrossed with feet flat on the floor, and their back should be supported. Bare the upper arm with no restrictive clothing, meaning you shouldn't push up a sleeve that makes a tight band around the arm. Be prepared to have a spot where someone can slip their arm out of their sleeve. You may need to educate the participant on why this is important. Not all people have had accurate blood pressures taken in their past. They may resist bearing their arm. The arm should be supported at the level of the heart, not left hanging or elevated, and the palm should be face up. If using an electronic monitor, palpate the radial pulse and check for regularity. If you find an irregular pulse, switch to using the manual cuff for an accurate reading. Select the proper cuff size for your individual participant. The cuff should cover 2/3 of the upper arm, and the bladder should circle 80% of the arm. Purchase a standard and a large size adult cuff. A pediatric cuff is typically used for children, but you may need one if you are seeing very petite older adults. Locate the brachial artery and place the cuff evenly and snugly over the bare skin, about 2 to 3 centimeters above the antecubital fossa, to allow for placement of the stethoscope. Be sure to align the mark on the cuff for the artery over the brachial artery. Ask the participant not to talk, and as a screener, refrain from making conversation during the measurement. Locate the radial pulse and pump the cuff 20 to 30 millimeters of mercury above the point where the pulse disappears. Place the bell or diaphragm of the stethoscope over the brachial artery, not touching the cuff. Avoid placing your thumb over the bell or diaphragm, and slowly deflate the cuff at a rate of 2 to 3 millimeters of mercury per second. Remember and record the number when the first pulsation is heard. This is the systolic. And when the last sound is heard, this is the diastolic. If the blood pressure is equal to or greater than 140 systolic or 90 diastolic, wait 1 minute and repeat the reading. Add the two readings together and divide by 2 to record the average reading. If you find a reading less than 140 over 90, record the reading on the form. All those little details about not talking and bearing the arm are actually very important, as we can see in this table from the Wisconsin Heart Disease and Stroke Prevention Program in 2012. It is clinically significant for a systolic blood pressure to be raised anywhere from 5 to 50 millimeters of mercury above normal because the blood pressure was taken over a shirt. It's also been shown that blood pressure is lower when you're using too large of a cuff and higher with too small of a cuff. Please make sure you are the one taking an accurate blood pressure. After you record the pressure, be sure to use the table provided to accurately discuss the screening results with your participant. You can find these tools located in the Big Tool Kit and educate them about their heart disease risk. The second screen in the Big Squeeze is waist circumference. Women with a waist circumference of greater than 35 inches or men with a waist circumference over 40 inches have been shown to have higher blood pressure. Explain the waist circumference measure and reason for the screening to the participant. Obtain verbal consent to perform the measurement. Don't continue if the participant is uncomfortable. Standing at the participant's side, have the participant help you locate their lowest rib, called the inferior margin, and the top of their hip bone. This is called the crestobilium. Find the midpoint of those two locations and mark the point. You can do this simply by keeping your finger on that point. Hold the end of the tape measure over the marked midpoint and ask the participant to wrap it around themselves. Measure around as little clothing as the person is comfortable with. Ask the participant to stand with feet together, arms at the side, palms facing inward. Make sure the tape is horizontal across the back and the front of the patient. As the patient breathes out or exhales, measure the circumference of the tape to the nearest 1/4 inch. Record the measurement on the form provided. Please be sure to educate the participant about their blood pressure and waist circumference results according to the materials provided in the Big Squeeze Toolkit. And that completes the training. Thank you for being a screener with the Big Squeeze. For more information, please visit www.thebigsqueezesf.org. Good luck and happy screening.